listening to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Calori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts.
Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Calori, and today we have a great episode for everyone. As always, today I'm joined by Aimee O'Reilly, pharmacist, owner, and pharmacy manager of O'Reilly Family Pharmacy here in the great state of Ohio. Today, we want to talk about Aimee's pharmacy journey, but we also want to chat about how she has implemented medical benefit billing to her daily workflow and find out the best solutions for everyone listening to see the pros and challenges of implementing it as well. Aimee, welcome to the show.
Thank you.
So why don't you begin with, let's have you tell us about yourself, where you grew up, where you went to school, and ultimately what led you into the pharmacy profession?
Yeah, so I'm a 2012 grad from Ohio Northern, and I think I have kind of a traditional trajectory into pharmacy, which is that, as a high school student, I loved chemistry. I was really into the sciences, and, someone mentioned that pharmacy might be a great fit for me because, they told me it was mostly chemistry. Turns out it's actually a lot of biology too.
Mm-hmm.
But what I have found is that, pharmacy was ultimately a really good fit for me because it's a service-based industry, and I live to help people and help people live healthier lives.
So as you were kind of going through your education, did you ultimately decide, okay, there's some chemistry, you found out there's some biology. So what kind of made you want to become an independent pharmacist overall, ultimately?
So I've always worked independent pharmacy. I interned at one as a student. After I graduated, I worked for one. I actually worked for two. And then I worked part-time for the Ohio Pharmacists Association for a period of time. And while I was there, my primary role was to help make independents more profitable, to create materials for them, do CEs for independents. And while I was there, I realized that I have a passion for it. I also joke all the time, I love to be in charge. So it's really a natural fit for me.
Yeah.
And ultimately I wanted to get the opportunity to practice the profession of pharmacy the way I wanted. And the best way to control that is to, own and decide how you want to practice every day.
So, you offer a good amount of patient services at O'Reilly Family Pharmacy. And as you said, as you went through your journey, you shifted to now, there's a huge service part and almost there's this part of pharmacy where you're always connecting with your patients. It's not just about compounding and doing all that fun stuff. You have to really not only know how to connect with your patients, but also now offer different services such as administering vaccines and whatnot. So, tell us about your offerings that you have at O'Reilly Family Pharmacy.
Yeah, so we are what has come to be known as a combo shop. So I offer traditional pharmacy services like you would see at any other retail drugstore. I also offer services to assisted living facilities and medication packaging services to patients living at home or in group homes. We do immunizations. We do the full complement. Pretty much anything you want, you can come see me for. We do medication therapy management. We do point of care testing. Most recently, we've gotten into doing disease state management, which has led to some of our medical billing processes. So, really a little bit of everything to try and keep people healthier.
Yeah, so let's dive into a little bit more of that medical billing. As you know, and maybe most of you listening, with the scope and practice and responsibilities expanding in recent years for pharmacists, administering millions of vaccines during the COVID pandemic, pharmacists are taking on a lot more medical responsibilities outside of their traditional roles. The federal government's starting to recognize this, understanding pharmacy medical billing now is more important than ever. So tell us why, and the audience, why you decided to use the Cardinal Health Medical Benefit Billing Program.
Yeah, so we have a program that we started with some of our assisted living facilities where my pharmacists, through a collaborative practice agreement with a nurse practitioner, would actually go on site and visit patients for diabetes, for hypertension, for cholesterol, to help, provide an additional level of service to those residents. To get another set of eyes on their diabetic medications. In particular, diabetes is really complex, and to help, with the dosing of everything and making sure that people are on the right meds for them.
Give me the biggest difference. So for anyone listening, what's kind of the biggest difference between pharmacy billing versus medical billing? I mean, I've the people that we've talked to in the past, I know there's usually a longer wait time to get reimbursed for medical. Mainly go through the differences between the two, just for everyone's information, and just to kind of know what those main differences are.
Yeah. So medical billing is, complex, and I did not fully understand just how complex until we really got into it.
I can only imagine. I mean, you have probably more claim denials. Is there more regulatory changes that come into effect with that as well?
So it's actually really interesting. Okay, so when you bill a pharmacy claim, let's life cycle a prescription real quick. When you bill a pharmacy claim, so it's all of the data that you need to bill the pharmacy claim, the BIN, PCN, group ID is right on the card. You use that information. You bill live, right, for your product, and you get a live response as to whether it's covered, if you need to cut down the day supply for some reason, or a myriad of other reasons, and what the patient's copay is. When you bill from a medical billing standpoint, there's several layers of complexities to it. So first of all, you have to know what you're billing for. So unlike with a pharmacy claim where you have a drug in front of you and you bill for a specific NDC, CPT codes and ICD-10 codes are, there's all kinds of modifiers to them. There's all kinds of different, for example, we learned, so in Ohio, for Medicaid, we have provider status. And so there were certain CPT codes that we could bill. And when I started my kind of pilot project at my assisted living facilities, I mentioned that my pharmacist was going to the AL. Well, what we quickly learned was that that's actually considered a home visit, which is a different CPT code than an office visit, which is what was approved in Ohio.
Interesting.
So,
okay.
Yeah. So, where you provide the service is important. How long you spend providing the service changes which code you use. What you do during that, visit changes which code you bill. And so there's just a lot of complex thought that goes into it. It's not just as simple as holding the drug in your hand and knowing which NDC to bill.
Totally get it. And that's really because when I was reading up on it, I had seen people running into just what you're saying. There's a lot of intricacies that you don't really think of. And obviously it's, from state to state, is everything, from your knowledge, is the medical benefit billing pretty different across different states?
No, so everyone uses like the CPT codes and ICD-10 codes
Mm-hmm.
are like worked on through the AMA and through Medicare. So those are like the HCPCS codes are the other things that you can use. Those are all, standardized. Now, depending on which state you're in, so like for us in Ohio, I have a payer through Ohio Medicaid that will pay for certain CPT codes.
Mm-hmm.
So which codes might be covered by which payers may change from state to state or payer to payer.
Yeah, that was my understanding. I just wanted you to kind of clarify that for me.
Yeah.
So once you kind of work through all the intricacies and you work out your codes and kind of the different, shifts in not only where you're performing, your service, or maybe it's inside the pharmacy, maybe it's outside, and you kind of work through all of that, what advantages have you seen from implementing a medical benefit billing in your pharmacy? Did it start off slow? Did it slowly gain a little bit more prosperity for you? Or do you feel like you were gaining a lot of advantages just off the line?
So I think the primary advantage that I have seen is, for what we're doing in particular, it allows us to have some really in-depth face-to-face time with our patients.
Mm-hmm.
And for my pharmacists in particular, they are, when we're doing these provider status initiatives, they are truly practicing at the top of their license. And so there's a lot of job satisfaction that comes with, really practicing at a high level and providing a quality service. And so, it's advantageous to finally see pharmacists be recognized for those services,
Mm-hmm.
for providing that information to physicians and working with patients and ultimately impacting the care that is received by patients.
So kind of a nice unforeseen advantage is just the ability to be able to connect with your patients on a different level by doing the medical and all these different services that you provide, correct?
Mm-hmm. Yeah, absolutely.
Yeah, and I think through a lot of the conversations we've had with other pharmacists, this has been their favorite time in pharmacy. I mean, obviously there's a lot of challenges, but when it comes to connecting with your patients, there's a lot more you can do these days, which I think is important.
Yeah, my pharmacists in particular really, love getting the face-to-face time.
Mm-hmm. So how has the pharmacy's use of medical benefit billing changed your service capabilities or even your business model? Have you had to rework a lot of things to, change what your pharmacy does? Or is it just basically you're able to add on more services? How do you see it?
Yeah, so we had to make some workflow shifts because like I said, now we have a pharmacist that isn't going to be on the counter, right? It's going to be somewhere else. So we had to make some workflow shifts in order to make that function and to really, take advantage of that opportunity. But I think, you see a lot of, time that you can free up with MedSync, with, some of those different opportunities to kind of condense what pharmacists are doing and allow them to then practice at a higher level.
I mean, it's a pretty tough time, obviously, with pharmacy, and there's staff shortages. When you're adding a lot of these services to your workflow, what's that been like for you overall? Has it been pretty easy? Have you been lucky, or was it a challenge at first?
It was definitely a challenge at first. Anytime you put new things on people's plates, you rock the boat. And pharmacy is, we like our pharmacists, we like our routine. Just as a general rule.
Yeah.
So it's, and we have to rely a little bit more on our support staff, right? Like I had to ask some of them to step up and take things on and push forward in order to maximize what my pharmacists can do. But I think overall, like I said, a lot of my team has found additional job satisfaction in those increased responsibilities and, has a lot of buy-in now in making those successful.
How do you feel what that timeline was? From when you implemented the new services, implementing benefit billing, and then getting to where you are now, where it seems like it's a pretty well-oiled machine at this point, how long do you feel like that timeline was between implementation and where you are now?
It probably took us a year to work out all the kinks. Yeah,
Okay.
there were a lot of hurdles that we had to overcome initially with the medical billing, in particular because we were one of the only pharmacies that was trying to bill Ohio Medicaid that wasn't like in a pilot project directly with Ohio Medicaid. So it provided some really unique perspectives, I think, to a lot of different people on like, how does this work? How do we what hoops do we need to jump through, and how do we enroll as providers all the way to, successfully getting a claim paid?
Yeah, I think also some of the trepidation with, including a new system into your workflow, it's always, how is it going to jive with my other systems I have in place? How is it going to interact? You being a Cardinal Health customer, I know Cardinal Health also has a lot of other solutions and services that we offer that you may or may not have. But, for the ones that you do have, how does medical benefit billing kind of interact with them? Or is it completely separate? Or is it just a pretty easy workflow in general?
Yeah, medical billing, the medical billing benefit probably most closely interacts with my immunization billing.
Okay.
Because you can bill on that side. So that workflow, I actually was just working through it yesterday because I had a bunch of denied immunization claims. And so it was great to be able to call someone and ask, like, why were these denied? How do I fix, it was a pretty simple fix. And then being able to reprocess the claim and correct it so that we can get paid was great for us. And in particular, because I had some insight now into it, the way that it reports out, I could see that those claims were denied and effectively work through them was really beneficial.
All right, well, let's get into your, the hurdles, because I feel like if there's anybody listening right now that wants to implement this, obviously you have to do this in stages, as you alluded to. It's kind of, adding your services and then figuring out the intricacies and how to build them as you go down the line. So what's the biggest advice you can share with any fellow independent pharmacists listening, interested in applying medical benefit billing to their workflow?
So I always tell people, anytime you're adding a service of any variety, perfect is the enemy of done. A lot of times we feel like we have to have all of the kinks worked out up front in order to implement it. And, one of the best things about being an independent owner is that you can be nimble and you can shift according to what you need. And so obviously you should have a plan for what your service is, but recognizing that plan doesn't have to be the end all be all, and that you can shift in order to make it more effective and more efficient or work better for your patients is a great mindset when you're working through some of these things.
Well, give me an example here. Give anyone an example of something that you implemented, whether it be in immunization or, as you said, going to folks' homes and doing, the work to bill it later. Kind of talk about the, a little bit of the journey from beginning to end and what it looked like then versus how it looks like now, and what those hurdles were.
Yeah. So when we started our, pilot project to do provider status, we had never written a collaborative practice agreement. We had never written protocols for this level before. And so there was a lot of concern around, is this right? Did we, hit all of the buttons? And so, I remember I was working with a couple of students at the time, and I told them, just put something on paper, start somewhere so that we can edit it and we can test it, within a little microcosm, and then we can build it out a little bit farther. And that was kind of how we worked through some of those processes. And we did that all the way through, even when we were billing, we would bill it, get it rejected, work through how do we adjust in order to get a successful claim.
And most importantly, your bottom line. How has medical benefit billing and adding these services helped your pharmacy's just financial outlook overall?
Well, one of the greatest benefits is that there's no DIR fees associated with them.
Well, that's big. That's definitely a big deal.
Yeah, everybody loves that, right?
Mm-hmm. Yeah, for sure.
It's a little bit more complex because the payment cycle is slower, and it's a little bit more complex to track. So it added a layer of complexity to understanding like where those dollars are coming in from. But anytime you can diversify your revenue streams is advantageous, right?
Yeah, for sure. It's one of the things that obviously it's a trending topic now, and it's a topic that we've talked about a long time here on the Counter Talk podcast. So with that, I really want to say thanks to Aimee for joining us on the show, providing a lot of in-depth information for the independent pharmacy customers and listeners around medical benefit billing. Well, I want to say thanks to Aimee for joining us on the show, for providing so much in-depth information for our independent pharmacy listeners. As always, I want to thank everyone for listening to the Cardinal Health Counter Talk podcast. We hope you enjoyed the show. If this is your first time listening and you haven't yet, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcasts. See you on the next episode. Thanks for joining us, Aimee. Take care, everyone.